May I take your date of birth, please?
What I'll do, sir, is I'll pop it on someone's list to do today.
The dreaded 8 a.m. scramble for a GP appointment.
So you last had an appointment on the 19th of June, which I don't think you attended.
Another symptom of an NHS struggling to deliver quality patient care.
So it's quite busy today.
But under the government's 10-year plan, the NHS will be a 24/7 service there for its patients when they need it most. It's promised to deliver thousands of GPs to drive forward its transformation of the health service. But Dr. Kumar has his doubts.
With things like national insurance and minimum wage increases, we've seen that our bills have got a lot higher and the funding hasn't supported that. So it means that we would struggle to recruit any more GPs from our current funding.
The 10-year plan will see a shift away from hospitals to community care, increase focus on prevention, and employ the latest technology.
I think the GP surgeries need to change because they seem to be the ones that hold everything up.
On paper, it sounds like a really good idea, but where are we going to get the staff?
I feel like the current Labour government does have good intentions. I think they really are keen to get it fixed. Obviously, implementing it is another story.
The government's 10-year plans have been broadly welcomed, but questions about delivery and workforce remain. Under Labour, GP practice has actually not got better, it's got worse. On average, 5.8 million people a month waited more than 14 days for a GP since Labour took office, compared to 5.4 million over the same period last year when the Conservatives were in power. So GP practice is becoming more inaccessible under Labour. 62 GP practices have closed since Labour came to power. So this idea that you're recruiting more GPs, training more GPs, more patients are having access to GPs isn't quite true. The numbers don't quite add up.
Well, it's a tide that we need to turn. And when I came in, I found this absurd situation where there were qualified GPs who couldn't find jobs at the same time as patients couldn't get access to a GP. And the decision I took within weeks of taking office was intended to get 1,000 more qualified GPs onto the front line within the year. We've actually got 1,900 onto the front line. But I take your challenge. I take the challenge on the chin about trying to stop practices from closing, to try and stop GPs leaving the profession, and to make sure that people have an improving experience in general practice. That's why neighbourhood health is such a big part of the plan.
10 years will feel like a long way off for patients struggling to access care. They'll hope that this promised revolution transforms their care much, much sooner. Ashish Joshi, Sky News.